your student nurse today. The nurse tech already came in and took your vitals. I'm here to do your physical head-to-toe assessment. Before we begin, let me go ahead and wash my hands. And can you verify some information for me? Can you tell me your name and date of birth?
Paula Hunau, 1/28/1983.
Okay, good deal. I'm going to start by inspecting your head. I'm going to start with your scalp. I'm palpating and I'm looking for any lesions, infestations, depressions, or abnormalities, which I find none. All right, and now I'm going to palpate your sinuses. I'm going to start with your frontal and move to your maxillary. I need you to tell me of any pain or tenderness. This is your frontal, maxillary.
All good.
Good deal. All right, now I'm going to palpate your auricles. Tell me of any pain or tenderness. Tragus. Okay, good deal. Now I'm going to inspect your eyes. They look symmetric. And I'm going to check your pupils now. They are reactant to light. Now I'm going to check your accommodation. If you'll look at the tip of my pen, and to the wall behind me, and back to my pen, and then back to the wall behind me, and then my pen again. Good deal. They accommodate equally. Now I'm going to check your sclera. Look down for me. Your sclera is white and moist. Look up. Your conjunctiva is pink and moist. Good deal. And now I'm going to check your nose. If you don't mind tilting your head back a little bit for me. Your mucous membranes are pink and moist. I see no deviated septum. Now look back at me. Go ahead and flare your nostrils. All right, and they're bilaterally symmetric. I'm going to check for patency now. And I need you to sniff through one side. And now the other. I hear no blockage. All right, now I'm going to check your mouth. Your lips are pink and moist. And now if you open up for me. All the way. Open up all the way. Good deal. Your hard palate is free of any lesions or sores. Soft palate is pink and moist, free of any lesions or sores. Mucous membranes, pink and moist. Tongue is pink and moist, and your teeth are white and in line. Good deal. Now I'm going to check your neck. I am looking at your thyroid, checking for any abnormalities or growths, and your trachea is midline with your body. Good. And now I'm going to listen to your carotid artery. I'm going to be listening for any bruits, which could indicate a blockage or narrowing of the vessel. Good deal. And I hear no bruits. And now I'm going to move to your cardiac, which is your heart, which is located between the second and fifth intercostal space. I'm going to palpate, looking for any visual pulsations. I'm also palpating the skin, checking for temperature, color consistency.
Should I take off my shirt?
Frills and heaves. No, you're good for this. Okay. And now I'm going to listen. I'm going to listen to your heart fills. I'm going to start at your second intercostal space where your aortic valve is located, just right in the sternum. Your second intercostal space, left of the sternum, which is your pulmonic valve. Third intercostal space, which is your Erb's point. Fourth intercostal space, which is your tricuspid. Fifth intercostal space, which is your mitral valve, also known as your PMI, your point of maximal impulse. And while I'm here, I'm going to listen to your apical pulse, and everything is good. And now I'm also going to listen to your lung fields, all 8 locations. Just breathe normally. Okay, good deal. Now I'm going to check your posterior thorax, if I can get you to turn a little bit for me. Good deal. I'm checking your spine for any scoliosis or kyphosis, which I find no indication. If you will take a deep breath for me, and let it out. Good. Your excursion is good. Your lungs rise and fall symmetrically. Now I'm going to listen to your lung fields, all 10 spots. And then your lateral right side for your third lobe. Good. Now if you'll turn back around for me, we're going to check your upper extremities. I'm going to check your brachial pulse and your radial pulse, and they're both bilaterally symmetric. Now I'm going to check your capillary refill, and they blanch within 3 seconds, which is good. I'm checking your skin now for temperature, moisture, and turgor, which everything looks great there. Now I'm going to check for strength. If you'll push your hands up against mine. Good. Now push down on mine. Good. Strength is good. Now we're going to check for range of motion. If you'll just put your hands to your side and follow my lead. We're going to raise them up. That's abduction. Flex them. That's flexion. Extension. Adduction. Great. All right, now I'm going to have you, actually, do you do a monthly breast exam?
What? No.
Oh, well, you should. It's good for everyone, including men, to do monthly breast exams. You're going to want to do them the same time every month for consistency. I'm going to show you how to do it real fast. If you'll go ahead and follow my moves, we're going to put our hand behind our head. With the other hand, we're going to start near the axillary, and we're going to work our way in a clockwork motion around the breast until you get to the nipple. And then you're going to squeeze gently and check for any discharge. While you're doing it, you're checking for any abnormalities or growths. And if you find any discharge or growths, you're going to want to contact your primary care physician to schedule a more thorough examination. Okay? Good. All right, now if I can have you lay down for me, I'll actually...
How do you want it?
right here. Put your hand right here.
Okay.
Good deal. All right, now I'm inspecting your abdomen area. Go ahead and put your legs down. Good deal. Now I'm inspecting your abdomen area. Please don't. No, it's all right. There you go. Hands to the side. And if you'll take a deep breath in and out. Good. Your contours, good. Your lungs rise and fall symmetrically. I am going to auscultate all 4 quads of your abdomen area, starting with your right upper quad, right lower quad, left lower quad, left upper quad. And I heard audible noises in all 4 quads. I could have heard hypoextension, hyperextension, audible, or absent noises. If it was absent, I would have waited up to 5 minutes per quad until I heard something. So everything looks good there. Now I'm going to move to your lower extremities. I'm going to check your femoral pulse, your popliteal pulse, your posterior tibial pulse, your dorsal pedis pulse, and they're all bilaterally symmetric. And while I'm down here, I'm going to go ahead and check your capillary refill. They blanch within 3 seconds, which is good. And now I'm going to check for range of motion. We would do this on both legs. We're going to go flexion, extension, abduction, and adduction. Great. Everything looks great. If you want to let me help you up. You can just sit back up now. You can get your shoes on, and we'll document this and have you out of here in no time. Thank you.
Awesome. Thank you.